Hello, people.
Hi.
What's up with the kids?
Welcome back to another show, something, the thing we do. Welcome back.
Yes, so we are here to bring to you something that you know very, very common, which is called sickle cell disease. And we are making this video because we are in a month of creating awareness for sickle cell, because on the 19th of June every year is the sickle cell disease awareness day. And so we want you to
be aware.
Yes, to be aware. If you have forgotten, just remember again to bring you up to breast with what sickle cell disease is, because it's very, very common, especially in our locality. And so what is sickle cell? You've been hearing about sickle cell, and you probably just some persons will call it, and this person is a sickler. Yeah, so that means
and the way they say it, it's really sickler.
Yeah,
the
person is always sick. It's not true. Now with a lot of advancement in healthcare and in treatment, these patients are not always sick, especially if they access or they're able to get access to the right care and early care and comprehensive care. It's you that don't have it that you're always sick. You don't even know the irony of things. And so this is not just for you. This is also for people who have been diagnosed with sickle cell, that there can be a light at the end of the tunnel. There's a green light, and there are things that you can do to improve the quality of your life.
It's not the end of the world.
No, it's not.
Stop beating yourself up.
It's not. You're warriors, and we are so proud of you. And we really want to, say that really empathize with everyone that is going through that. You might think that we don't see you. We see you. We see how you fight each day to stay alive. We see how you fight each day to break through that major hurdle.
Even the caregivers.
You understand? School, jobs, you're doing so much things, you're achieving so much, and we see you, we appreciate you. And for parents who are feeling sad that probably they did all their best to, try to prevent this happening, and you caught yourself, and it finally caught up with you. We say we see you, we empathize with you. We see how much you're caring, and we are here to tell you that you're not alone. We love you and we appreciate you. Okay. So now let's dive into our topic, sickle cell disease. So what is sickle cell disease? It's just basically a genetic condition in which there is abnormal hemoglobin. Just understand that. And this would affect the red blood cells, because these red blood cells, blood that is flowing in our body, they have cells. And so what we are concentrating on is the red cells of the blood. And these red cells have hemoglobin, and this hemoglobin does a lot of functions by carrying oxygen around our body. So if this hemoglobin in the red cells is defective, it gives rise to what we call sickle cell. And defective means that it's the child or the person inherits the SS gene, right? So there are different types of hemoglobin genes. You have the A, you have the S, you have the C, and there are so many ones, but these are the common ones. And so when we are talking about sickle cell disease, we're talking about few children that inherited an S from the mother, or also an S from the father. It can also be a milder form, but S and C. It can be either ways. Don't quote me wrong. Go before you see a child that has SS, you say, Lila, it's from the father. So normally, when they inherit this defective gene, the hemoglobin gene, from the mother and the father, it predisposes them to having sickle cell genotype. And there are different combinations, okay? So we won't go very, very deep into those combinations where you say, no, you must have seen them. A and A can marry, A and S cannot marry, and all of that. So I think the one you should know is AS and AS. You have no business getting married, because you have the possibility of donating your S and the man donating the S and giving it to the child. And you also have the SS, you don't even have any business marrying anybody that has S in it.
Or even C.
You don't have any business marrying them. This. Okay, let me not go too much. Then you also have the C, like we earlier mentioned. So probably one is AC, the other one is AS, and you all donate the C, and the other one donates the S, and they get married, and they donate that to the child. And so these are some of the combinations. But maybe in our comment section also, we'll probably put all the combinations that you should know
go for.
that predisposes them to having, that increases the risk
of them coming down with sickle cell disease, right? And then, majorly the main concern with sickle cell disease is the fact that because they have that defective gene, right? Their cells are prone to having an abnormal shape, sickle, like the word. So it sickles, right? As opposed to being, bouncy and round and spherical, it will just sickle. And then it will become like rigid. It will be strong. It won't be flexible. And then the lifespan of the cells, normally you have red cells living as long as 120 days. That's why they'll tell you can donate blood every 3 months. But for people that have sickle cell disease, their red blood cells live like 20 days, right? So all these things play a role. So even when they're exposed to things that stress them, like exercise, things that reduce the oxygen level in the blood, that puts your body in such a reduced oxygen mode. For people that don't have sickle cell, their body would just compensate and push forward. You'll be jogging and everything, your body will just you come back, you rest, you're good. For those that have sickle cell, when those low oxygen states happen, everything sickles and stuff like that, the cells will be struggling to pass through the blood vessels. You get, and so they can go there, block those tiny blood vessels. By the time they block them, oxygen won't be getting to that particular part of the body, and then they start having the manifestations. And it can affect literally any part of the body, like the brain, the bones, because the bones will even be overworking. They'll be trying to produce more cells because they'll be wondering, why is there no oxygen? Okay, let's produce more blood cells so that your body can have more oxygen. And they'll just be overworking, and the child will be in pain. Even the intestines or
everywhere, lungs,
the kidneys,
the penis, the eyes.
You're a bad girl. Even she say penis.
Everywhere.
But everywhere, no jokes, literally everywhere.
Even your growth.
Even the growth of the child. Right? Even the shape of the head, the shape of the limbs. So that's why when we shout sickle disease, it's painful because one is preventable, right? We won't really believe, because I've had instances where they said they did their genotype and they gave them the wrong result. And that's why we're saying, if you're checking genotype, check in 3 places.
That's true. And check together. Check together.
You
don't check differently. Check together.
Check you and the person you want to get married to, and don't check it in just one place. Don't take it, except you have been checking in the past and you know what it is. But if not, check here, check here, check here. Take if it's the same result. But if you're saying different results, it raises an alarm. But aside that, it's preventable. And even when the child has come down with it, so many measures that keep most of them are healthy.
Very, very
achieving things. Doctors, engineers, like big boys and big girls that they lead themselves that you don't even know.
You notice that even in our centers, we've compared that those patients that usually have crisis are patients that are not well followed up. In clinics, and it has to be a specialist clinical, or maybe you can't have access to a specialist in this sickle cell disease. But we'll notice that all our patients that are on follow-up, attending, they're compliant with their medications, clinic visits, they barely come down with those complications of sickle cell. So for those that we always have that come down with complications, with painful crisis, are probably those that were not well managed. And I don't put it on the kids. I put it on the family.
Parents.
Yes, because that is child negligence.
So why will you be treating malaria every month?
Do you understand?
Every month.
Do you understand? And and another thing again with this prevention, I think we don't talk much about it, is that once you're of age and you know that you can fall in love, please know your genotype.
Know your genotype.
Because you can't tell when things would happen.
It's a first date question before you even fall. Before you fall in love, because when you fall, sometimes it's hard to stand up.
Do you understand?
So before you fall,
So Because you never can tell when things will happen. You know, say you had unplanned pregnancy, and that child is,
because it's a simple but boy and fine. Please, what's your genotype?
That is it.
AS.
So don't wait till when you say you want to get married, then you start checking your genotype and say, yes, I want to get married.
If you're even AS or SS, you should demand for the results. Because
it should be a criteria. Before you say I love you, just say, please, what's your genotype?
You can lie you. If you catch yourself saying I love you without knowing genotype, hey,
keep quiet.
What's your genotype, please?
So
protect yourself.
And as someone who is SS, ensure that you're falling in love with someone that is AA. You have no business with someone who's other genotype that is unsure.
Yeah.
And so, like we said earlier, right? These people tend to live healthier lives, even good lives. But it all depends on the care. And I think one thing that we could stress is the government or our leaders again, everything has to boil down with our leaders, because those people making care for them accessible and affordable. And because
finish.
Yes, affordable, because sometimes their care might demand a lot of finances. And so people that can't afford certain things, I'm not scaring you. Some of their cares are very affordable, please. Don't get us wrong. But there are sometimes that you might have to spend a little bit. There are some tests you have to do, follow-up tests yearly, and the rest of it, depending on what your physician sees. So I feel that how we can make those tests affordable, because we've seen patients in our clinic, SS patients, and they tell you that there are some tests that they have to do, but they've been unable to do because of the costs
for years
of doing it for years.
But before we even get ahead of ourselves, okay, I know most times when babies are born, there's this routine screening some places do, but like you said, things are not even as good as they were. So a lot of places no longer even do newborn screening. But for what it's worth, you will most likely not be able to do. You will not be able to do your baby's genotype at birth.
Yeah,
because it won't give you the right results. So usually the advice is when the baby is 6 months, has done 6 months of life. So from like 7 months of age, you should check your baby's genotype, right? So at that moment, take any opportunity. Your baby is running a fever, you're going to the hospital for, as you always say, begin get malaria. At that point, you can just ask, let them do this genotype of this child so you will know.
Yeah.
Right? But if you have missed it and you didn't check, but you're seeing signs like maybe swelling of the as in fingers, the baby's your child's always complaining of pain in the limbs. Sometimes you're not seeing anything, you just the eyes are yellow.
Yeah.
That's all you're seeing. That this baby's eyes are yellow.
Could be a sign of
sickle cell, or child is always falling ill.
Yeah.
It could just be a pointer to the fact that this child
even convulsion. I remember a patient that we had said the child had convulsion, and when they came to the hospital, they checked the genotype and it was SS.
The one I even very recently, like 2 weeks ago, it was blindness.
Oh,
sudden onset blindness. And then when I saw the child speaking with them, I found out that it's sickle cell, right? And you're like, if I just kept on thinking to myself that day, even beyond that call, that if these people knew, right, it could have been prevented. And if because the child had actually gone to multiple hospitals, and we were the first people telling them that this is what it is. They had even seen the eye doctor. We're the first people telling them that this is what it is, and this is not a small child. This child has gone to like the double digit ages, right? And I was like, if this is something that if they found out about this in like 6-7 years ago, we will not be here. So now let's assume this child never gets this child's setback.
Yeah. And
they were telling me that, this child has had a stroke before.
Oh, God.
You understand? You're hearing stroke, and you're
one of the common causes of stroke in childhood.
Yeah. Sickle cell disease causes stroke in children.
And importantly, please guys, I know we believe in God. I know that we want the best for our child, but oftentimes we are really uptight when we get the diagnosis that your child is SS. And because of that, you don't accept care and you take that child, yes, you neglect because you don't want to believe, because you believe that if you accept that diagnosis and you seek care, that means you're accepting the words of the doctor. So if you're in that conditions, I understand you. Sometimes you are in the face, you can't accept certain things. You can go somewhere else. We check that genotype, and when it's confirmed that that child is SS, please don't deny that child any care or any form of medical assistance.
It doesn't affect your faith.
Yes, it doesn't affect your child, the faith or your belief in God. Please get that child to get help, because I don't know what to say here.
And like, how do you care for these children that they're told have sickle cell? It's I will not say it's simple, because it's not simple, right? But it can be a bit straightforward. There are some rules that if you follow, it will help.
Yeah.
There are some things that trigger them, right? Extremes of temperature, cold, heat. This is not the type of child that you be keeping in the AC of 14, 16 degree, or you keep in very hot places. Yet this is not a child that you want to be doing strenuous exercises. Yes, strenuous activities, because these are things that can trigger crisis, right, in the child. This is not a child that you notice fever today and you're treating anyhow. No, for them, infection is not a joke. Once there's any point out to any form of infection, you treat immediately. And so these are children that should get their routine immunization.
Yeah,
they should sleep under mosquito insecticide treated nets. Mosquitoes should not be biting them. Clean your environment, because malaria for you is not malaria for them. They must take their routine drugs, right? They must attend their routine clinics beautifully. With the clinic time schedules get longer. There's some of them that they see once every 4 months, once every 6 months, depending on how it is. Not every week. Initially, it can be a bit, but once you've gained momentum and they see the child is doing well, you just be coming for follow-up clinics. Occasionally you could do 4 times in a year. They'll let you know the tests that you should do. There's some tests that they do just maybe once in a year, twice in a year, some tests, so just adhere to those things. And very importantly, when these children start growing old enough to know, please teach them.
Yeah.
They should know. I shouldn't be having a 12-year-old who doesn't know the person has sickle cell disease, and you're shouting, drink water, because water is very important for them.
Yeah, very, very important. Very, very important.
They must be hydrated.
Always.
You're now beating a 12-year-old that the child is not drinking. Does the child know why the child needs to drink this much water?
Yeah, Lolo, there's another part of this sickle cell patients that is very, very interesting, in the sense that once they become teenagers and they understand what sickle cell disease is, they become resentful
towards their parents. So that's usually the fear. That's why the parents don't like to let them know.
And when they know and they become resentful, they begin to default on their medications.
True.
So because when they are kids, their parents are the ones giving them the drugs, doing everything, covering them. But once they understand, they say no. Probably they want to punish their parents. And we understand you're genuine, your concerns are very genuine, because they feel like this is a condition that was caused by the both parents, and you're giving it to me. I'm the one bearing it alone. So they become very resentful. They don't want to comply. So we are begging you, please, as teenagers, we know that you now understand what sickle cell disease is, but this is not the time for you to, refuse care and despise everyone around you. I'm very sure that your parents, if they had the ability to change things,
they will.
But it has happened. So how do we push forward to ensure that you live a good life?
Those children, the truth of the matter is that you bring them, let them, when they come to the clinic visits, right? Allow your doctors talk to them.
Yeah.
You are as the parents, you are the, will I say, problem, in quotes now, problem bringer. Right? So you may not be in the best position to actually speak to those kids. They may need even a psychologist to actually talk to them, to let them know that, oh, it wasn't really your parents. Let them know that, oh, it was a faulty result. Let them know, because some people don't know the burden of these illnesses until, so when they were telling you that time that this child will have, so some of them were even, they'll tell you, 1 out of 4 children may have. But what you don't know is that if you're AS and this person is AS, for every time you're pregnant, there's like a 25% chance that that pregnancy, the child may have SS. And then imagine if all the pregnancies, all the children now had SS. So people did not know.
Yeah.
They thought it just meant that if you have 4 children,
it's
one who has to. So some of them may plan that we'll have only 3 children.
Yeah.
Only 2 children. And then unfortunately 2 are yes. So I've even had people tell me that, they didn't know. So after the first child, they don't want to have any other child again because the first one had SS. So the child may not understand.
Yeah.
So you bring them to us, but they will start asking questions. Mommy, why am I drinking drugs every day? My mates are not drinking drugs.
Yeah.
Mommy, I'm not taking this drug again. Put your hand in there, they'll bite you.
Please, just if you can't talk to them, bundle them to
come to the hospital. Let's help.
We will talk to them. And so, what else again?
That's basically it.
So it's something that you can live with if you get all the measures right.
Yeah.
You do all the things that are expected of you, which you've already mentioned in your videos.
Drugs.
And so we hope that with this, everyone becomes a sickle cell warrior, spreading their awareness. And I think we should be able to freely talk to people about it, especially sickle cell. You understand your problems. You understand what you're going through. You should be able to talk to people about it.
If they have the money, they can go further and do the whole bone marrow.
The stem cells transplant. And that's where our government too
should help subsidize
that care for them.
To show you how much technology has improved, right? SS is not the end of it. If you even also have the finances, subsequently you could do an IVF pregnancy, do some genetic selection, and when you get pregnant, you do all those testing in vitro. I know there's a lot.
Yeah.
So please don't be depressed. Come to the hospital, bring these children. We have colleagues that are sickle cell survivors.
Yeah.
Warriors, right? So it's not the end of the world.
So guys, thank you so much for listening. We had so much fun talking to you about it, and I hope that you learned so much from this episode. So please don't forget to like, subscribe, comment, and turn on your notification button so that whenever we release our new content, you will watch it. Thank you.
Thank you.
Bye.